Today, Health and Human Services Secretary Robert F. Kennedy Jr. announced he is replacing the entire independent committee that advises the CDC on vaccine usage, claiming members had too many outside conflicts. This comes as hundreds of scientists and researchers at the NIH are publicly calling on the director to reverse massive budget and research cuts. For tonight's interview, we are joined by Dr. Celine Gounder, a CBS medical contributor and editor-at-large for public health at KFF Health News. Good to be with you again, Doctor. Let's start with the CDC, with the vaccine panel. What do you make of that decision?
This is really unprecedented. For decades, the ACIP, this external panel of experts to the CDC, has been advising on vaccine safety and efficacy, evaluating that in a nonpartisan, non-political, strictly scientific, and frankly, really boring kind of way. And all of a sudden, this is being politicized. I'm hearing reports from some who have been involved in the process that the secretary is also planning to censor what data is presented at these meetings. And so this entire process is being injected with ideology in a way that will compromise trust in public health.
What's the mood, to the extent that you know it, inside the NIH and the CDC on this very specific question? Because this was asked at the hearings. This is kind of, well, what's the mood on this question?
On this question of politics and partisanship and ideology being inserted into science? Well, frankly, for the last weeks, months, I feel like I have been mainlining frustration and anger and desperation and really from career scientists who do not understand what is happening. These are people who, quite frankly, in the private sector could be making 2 times, 5 times, 10 times as much money. They're not doing what they're doing because they're looking at profit. They're looking at serving people. They look at their love of science and having an impact. And this is really disconcerting. The ground is falling beneath their feet in terms of what they are used to doing.
Right. Now let's go to this letter at NIH. 2,100 researchers, the letter mentions 2,100 research grants that have been terminated since the start of the Trump administration. Explain to people why grants are important, what they do.
So this is something that dates back to right after World War II. The U.S. government was under FDR. He had an advisor who wisely told him we should be investing more U.S. government money in scientific research. We had learned, what the impact was of the Manhattan Project during World War II. Mm-hmm. So there was this massive influx of funding for the NIH, the establishment of the National Science Foundation, and other such initiatives. And what we have succeeded in doing in this country is we've really put our economy on tremendous fast forward with this kind of investment. We have helped protect our national security, and we've helped protect public health. And so when you pull back on this funding, that leaves us vulnerable to attacks on numerous fronts.
20 seconds left. The director of the NIH says that the letter has some fundamental misconceptions about the policy direction of the NIH. How's that likely to go over?
Well, I think you have 2 different sets of agendas also. You have DOGE and the cuts that are being made under DOGE, and then you have the ideology. And in fact, DOGE cuts are being used to provide cover for some of those ideological cuts.